Welcome to another video of Concepts of Anatomy. आज हम पढ़िबा Serratus anterior and winging of scapula. Okay, तो Serratus anterior origin कोठ होची? It originated by 8 digitations, okay, from outer surface and upper border of upper 8 ribs. Upper 8 ribs from 1 to 8, right? Plus fascia covering the intervening intercostal muscles. इंसर्शन कहाँ पे होगा इसका? इंसर्शन होगा कोठी टू द मेडियल बॉर्डर एंड कोस्टल सरफेस ऑफ स्कैपुला. केमती इंसर्शन होगा ना? फास्ट सेकेंड माने डिजिटेशन तार डिफरेंट डिजिटेशंस डिफरेंट जगह इनसर्ट हे. जमती कि फास्ट डिजिटेशन कोडी इनसर्ट होगा अटैच टू द एरिया फ्रॉम सुपीरियर एंगल ऑफ स्कैपुला टू रूट ऑफ स्पाइन. ठीक. Second and third digitation, sometimes fourth digitation also attached to the narrow strip along the medial border of scapula. Also medial border plus right it costal surface. And remaining digitations, remaining 4 to 5 digitations. ये गोटे डिजिटेशन गला ये 2-3 आउ रहा 5टा डिजिटेशंस 4 to 5 डिजिटेशंस. जदि एठी जदि हियर 4 डिजिटेशन सेकेंड थर्ड एंड फोर्थ डिजिटेशन आसीगला ताले एठी 4टा डिजिटेशन बाकी रहिला. जदि इधर सेकेंड थर्ड रहिला फोर्थ आसिलानी तो 5टा डिजिटेशन रहिबो. तो रिमेनिंग डिजिटेशन कोड इनसर्ट हो इनसर्टेड टू द इन्फीरियर एंगल ऑफ स्कैपुला. ठीक अछि. सेटा देखिए आम. सो यहाँ है गोटे स्कैपुला आमर, राइट. व्हिच साइड स्कैपुला इट इज? right, this is right side scapula. This is right side scapula. Okay. Now scapular it is a costal surface. This is a costal surface. This is a dorsal surface. ना costal surface रे की insert हो पिला माने costal surface रे हमर insert हे फास्ट तो big muscle गोटे insert हो सेटा ला कोन subscapularis. This is subscapular fossa costal surface रे अछि. एठी insert हो हमर subscapularis. ठीक. तो this is our medial border, this one. This is our medial border and this is our lateral border. So in medial border and in costal surface, because medial border would costal surface achi. Okay, this is also medial border at the dorsal surface रे. तो medial border है dorsal surface. तो medial border costal surface रे किछि मसल attached है, medial border dorsal surface रे किछि मसल attached है. ये serratus anterior टा से medial border रो costal surface रे attached है. Here this is our medial border costal surface, this is medial border dorsal surface. तो medial border costal surface एठी से attached है. तो से केमती attached है ना तीनटा जगह तर अटैचमेंट हम. गोटेला स्पाइन रे हम. ठीक. दिस इज द स्पाइन, सुपीरियर स्पाइन, दिस इज इन्फीरियर स्पाइन एंड दिस इज द नैरो स्ट्रिप अलोंग द मेडियल बॉर्डर. एमदी तार इंसर्शन टा हम. ठीक. सुपीरियर स्पाइन रे को डिजिटेशन अटैच्ड हम फर्स्ट डिजिटेशन. Now medial narrow strip border, medial narrow strip area, the medial border, second and third, sometime fourth. Rest 4 to 5th to the inferior angle. 4 to 5 digitations. To inferior angle. ठीक. तो जान पाला केमती इंसर्शन है. दिस इज मेडियल बॉर्डर कोस्टल सरफेस रे फर्स्ट डिजिटेशन सुपीरियर एंगल रे इंसर्ट हो. सेकेंड एंड थर्ड डिजिटेशंस नैरो स्ट्रिप अलोंग द मेडियल बॉर्डर रे इंसर्ट हो and third digit 4th to 5th digitations remaining digitation guda kodi insert haba na inferior angle of scapula. Okay, so nerve supply kon nerve supply hela long thoracic nerve. This is the long thoracic nerve. Root value kon haba long thoracic nerve ro pila mane C5 C6 C7. Now speciality long thoracic nerve ro kon na it originated from root origin हवार ठीक है केमती root origin हम see this is our C5 C6 C7 C8 T1 this is our roots of brachial plexus trunk पड़े आसले upper middle and lower trunk तो long thoracic nerve टा एते बाटे जीवन long thoracic nerve एटू पड़े आसियो long thoracic nerve टा C5 C6 and C7 एमती पड़े आसियो. See, you can see here. This is the long thoracic nerve. Cadaveric image. This is the long thoracic nerve. So this is artery. This is long thoracic nerve. Now sometimes it is long thoracic artery but here what we have seen in our dissection in our dissection table, we call it as thoracodorsal artery. Thoracodorsal artery. Now thoracodorsal artery कौन करे पिला माने thoracodorsal artery anastomosis with what deep branch of transverse cervical artery where at the inferior angle of scapula forming the scapular anastomosis. This is our long thoracic nerve. Okay, एटू पड़े आसला हमर C5 C6 C7 रूट आसला हमर long thoracic nerve. ठीक तो what is the action of serratus anterior? It protract and forward pull of medial border of scapula. Okay, understand बुझिवा सेटा कौन actually तो एतिक जिनस हमारा serratus anterior origin. It is a very important question for short note. Origin by 8 digitations and from 8 digitations from where? From outer surface and upper border of upper 8 ribs plus fascia covering intervening intercostal muscles. Insertion कोठी हबो ना medial border and costal surface of scapula. First digitation कोठी हबो first digitation insert of superior angle रे. Second and third digitations narrow border narrow strip along the medial border habo and 4 to 5 remaining digitation जोड़ा कोड insert हबो ना inferior angle रे insert हबो. ठीक nerve supply कौन nerve supply long thoracic nerve root value C5 C6 C7 कोड origin up from the roots origin हबो roots रो की origin हुए. Also from roots another nerve originated, that is dorsal scapular. ठीक okay and action protraction and forward pull of medial border of scapula. Now there is a condition called winging of scapula when there is an injury to the long thoracic nerve. Now why it is called winging of scapula? It is called winging of scapula because the affected scapulas look like wings. You can see these are look like wings of birds. These are the bird. This is the bird photo. See, these are how the wings look like of a bird. Exactly the retracted medial border of scapula. These scapulas are retracted. Okay, retracted. So retracted medial border of scapula occur because of paralysis of long thoracic nerve that causes the palsy of serratus anterior muscle. Because the scapula will be retracted here because serratus anterior कौन करे protraction करे and forward pull करे. तो forward protraction ही परिवनी एतरे तो किए ओवर एक्टिव ही जीवा हमरो serratus anterior को किए balance करंती. तो सेते में हमको डॉर्सल बॉर्डर रे को मसल अटैच होछन सेटा देखिया पड़ियो. डॉर्सल बॉर्डर रे सभा ऊपर को मसल अटैच होछि. दिस इज अ डॉर्सल बॉर्डर, दिस वन मीडियल बॉर्डर डॉर्सल सरफेस ठीक तो सभा ऊपर किए अटैच्ड होची हमर एठी levator scapulae ठीक देन rhomboides minor then rhomboides major rhomboides major levator scapulae okay so emane kon karanti these three muscles as well as the middle fiber of trapezius along the spine outer border of the spine amara trapezius insert haba eti ठीक है here trapezius insert haba middle fiber of trapezius now emane kon karanti na emane retract the scapula kemti see here you can see two axons here you can see two axons this is and this is you see this is the mid axis jodi ami mid axis draw kariba ethi this is the mid axis of our body this is the mid axis of our body ठीक so you can see here these two medial border of scapula are going towards the mid axis that is retraction and here the medial border of scapula are going away from the mid axis this is called protraction so protraction major muscle ki hela serratus anterior now retraction major muscle ki hela levator scapulae rhomboides muscles and middle fiber of trapezius now जेतले serratus anterior palsy हे जिवो so माने the scapula protract हे परिवनी so these muscles the levator scapulae rhomboides major minor and middle fibers of trapezius are overactive हे जिवे माने so when they become overactive they cause what they cause winging of scapula winging समान कर देवे how winging समान कर देवे by over retraction you see these borders are over retracted and cause wing like appearance of medial border of scapula so this is called as winging of scapula you just write winging of scapula means the paralysis of serratus anterior muscle due to injury to the long thoracic nerve I'm just trying to explaining here so I have done a lot of things again so till now you are clear that why it is called winging of scapula because the if you see the wings of birds it also look like this exactly eta ei bhali dekha jibo that's why it is winging of scapula okay see here is the diagrams these are the levator scapulae muscles these are the rhomboides muscles and here you can see this is trapezius inserted to the this is spine of scapula these are trapezius these are the middle fiber of trapezius these are superior fibers these are inferior fibers these are middle fibers so the middle fiber of trapezius as well as rhomboides and levator scapula these muscles are called cause retraction of scapula and when the serratus anterior got paralyzed they got over retracted ठीक so एतरे आमे आउ किछि देखिबा what else na what are the other muscles that scapula presents see this is the dorsal surface ala eta ame scapula देखिबा this is dorsal surface abo dorsal surface supraspinatus fossa ro baharibo ki pila mane supraspinatus infraspinatus ro kiye variyo infraspinatus fossa ro kiye variyo infraspinatus now this is our glenoid cavity okay this is infraglenoid tubercle now here this area is our teres minor. This area is our teres major. Okay, एठी ऊपर आम कौन देखिले here levator scapulae, here rhomboides minor, here rhomboides major. Right, एठी के insert हवा here insert हवा हमारा trapezius outer border, trapezius, right. So this is our what? This is our costal surface here, this side costal surface एटा. तो एठी की origin हवा हमारा subscapularis, then एठी के insert हवा here fast digitation, here second and third digitations, here हमारा 4 to 5 digitations of serratus anterior. ठीक, this is the acromion process here, this is the coracoid process. tip of coracoid process ru हमारा दीटा मसल origin हेवे, गोटे insert हवा. which muscle is inserted? insert muscle है pectoralis major minor, sorry pectoralis minor. ये है insertion and की origin है ना biceps brachii plus coracobrachialis, they will origin. Okay, so hope you understands. Thank you.